While handling surgical instruments, one should have a firm but relaxed grip so that you can get the proprioceptive feedback from the instrument. While using the scalpel, cut with the belly of the knife. One should cut the skin and subcutaneous tissue in one long, deliberate stroke. The scalpel may also be used to define a facial opening in a hernia. Medicine-bound scissors, or METs, are blunt-tipped, slender instruments ideal for dissection and delineating planes. While using forceps, one should use a light grip to prevent crushing of the tissues. The friction between the teeth or the serrations grip the tissues. While using the needle holder, use one of the correct size. Remember to pronate the wrist completely before supinating to take a bite into the tissues. While using the hemostat, grip the bleeder just behind the bleeding point, and one should grip the tissue just as the diameter of the vessel. Small Halsted, Adson or Crile hemostats may be used for small bleeders, whereas for larger bleeders one may use a Kelly. One may use a mixed right angle clamp in tricky situations. In the year 1894, 3 steps were suggested for hand washing: using warm water, medicated soap and a brush for 5 minutes, followed by application of 90% alcohol for 3 to 5 minutes with a brush, followed by rinsing with distilled water. The final drying was done by a towel. Sterile gloves reduce the risk of blood-borne infection from the patient to the surgical team. Studies have shown that up to 20% of gloves have punctures after surgery, and more than 80% of them are unnoticed by the surgeon. After 2 hours of surgery, 35% of all gloves demonstrate punctures, and these allow fluids to penetrate without any pressure. Double gloving is useful, but punctures are seen in 4% of cases of double gloving. Punctured gloves double the risk of surgical site infection. Remember that gloves do not necessarily prevent contamination. Kowai et al. Have shown that the same strain of coagulase negative staphylococci from the bare fingers of the cardiac surgeon were found from the patient with post-operative endocarditis. When one wears gloves, there is a rapid multiplication of skin bacteria which occurs under the gloves. The medicated soap reduced the colony-forming units for up to 6 hours. In decreasing order of activity, chlorhexidine gluconate, followed by iodophores, followed by triclosan, and finally plain soap. Warm water makes antiseptics and soap work more effectively, while very hot water removes more of the protective fatty acids from the skin. Depending upon the agent, one may use either a 3-minute scrub, which is as effective as a 5-minute scrub. O'Shaughnessy et al. Used 4% chlorhexidine gluconate in scrubs of 2, 4 and 6 minutes duration. There was a reduction in count in all groups, which showed that scrubbing for more than 2 minutes did not confer any distinct advantage. Thus, the recommendation is 4 minutes for the first scrub and 2 minutes for the subsequent procedures. Almost all studies discourage the use of brushes, and several methods of drying have been tested without any significant differences between techniques.